thank you for having me here today, and thank you for that lovely introduction. My name is Thamanya, and yes, I'm a dentist. So yeah, when it comes to dentistry, what's one of the first things you think about? Oh, it's just about fixing teeth, right? Maybe some of you think it's about making money, easy money, good money. Some of you think, oh, I'm going to visit the dentist, you're reminded of the sound of a drill, maybe the blood and gore of taking teeth out. But dentistry, it's heavily misconstrued. There's a lot more to dentistry than just that. It's a career that combines both science and art, and helping and giving back to your community, helping them to improve their oral health. So taking it back to when I was your age and doing my GCSEs, A-levels, I have to say I wasn't sure what I wanted to do. I knew I enjoyed the sciences. I knew I wasn't ready to sit behind a desk for the rest of my life. I had to be in the field. So 2 easy options, medicine, dentistry, right? Medicine, that's definitely something my parents, being part of the Tamil community, pushed me towards. And I didn't have any dentists in the family to question. But, and out of curiosity actually, how many of you actually enjoy visiting your dentist? A show of hands. Wow. Okay, just a few of us. Okay, I had a really special relationship with my dentist. I was really close to him, he was great, and I was intrigued by what he did. So I thought, why not take some work experience on board and see what dentistry is truly about? And that really changed my whole perspective. I loved how hands-on dentistry is. As a clinician, you're truly independent in making your own clinical decisions. You're not having to answer to someone senior. You're making your own decisions. You're treating patients from beginning to end. And that really resonated with me. And more than that, it's the relationships that you build with your patients. I was always happy to talk to people. I enjoyed being in people's company. And that really helped me decide, okay, dentistry's for me. But on the flip side, and I know I've spoken to a couple of the panelists here, some of them have done dentistry as work experience and they've not enjoyed it. And that's fine and that's normal. And this is one of the things I would say to you guys is do the work experience in whatever field you choose to do. That is so important because that's what's going to help you decide whether or not you are truly passionate about that. So yeah, I decided dentistry is for me, and just to give you a bit of background about the pathway, I went to King's College for dentistry, took on the rigorous 5-year course that it is, and it is intense. Dentistry is super intense. It combines both academic knowledge and clinical skills. You have to start that from an early stage as well. And you're having to balance exams and lectures and seminars on top of being in clinic as well. So it is really challenging, but it's also rewarding in the sense that you get a really good foundation as to what working as a dentist is like in the real world. Just to give you an example of how challenging it is, and not to toot my own horn, but I was a high-flying student through high school. I got the best grades in GCSEs and A-levels. Come to first-year dentistry, I failed my finals. And that really put me down. But just to give you an idea, having one bad grade, failing 1 year at university, that's not the end of the world. You have to pick yourself back up and you have to be resilient. That's really important. Don't let it get to you that you've done badly in an exam. Don't let it get to you that you've not done so well on a specific coursework or whatever. That does not matter in the grand scheme of things, guys. So just bear that in mind. So yeah, going back to dentistry, like I said, because it was so challenging, there's definitely a lot of mental stress involved. You do have a few students, definitely in my year, that dropped out, which is, again, okay. But one thing I would say is have an outlet for your stress, and that's also important when you start your career as a dentist as well. You need to have a hobby outside of your degree. And especially in university, I'd encourage you guys to join societies, to play sports. I did a couple of dance shows as well, which enables you to kind of join bigger social circles, meet people outside of your dental degree, see what else is out there, and that's really helpful as well. So after university, you go on to do your foundation training, which is a must for all dental students. It's a year where you work in an NHS practice under a supervisor, and you're becoming more and more independent. You're seeing your own set of patients, you're managing their treatment plans, and you're building upon your communication skills. And then you can either choose to stay on in practice, or you can go into specialty training, and there's so many specialties within dentistry. If you want to know more about it, ask me later. But I decided to go into MaxFax, which is a combination of medicine and dentistry, and that is a completely different world. You are working alongside doctors, dietitians, physiotherapists, and you're working in a really wide team. So again, that helps you build your communication skills. You're treating patients with jaw fractures, skull fractures, huge facial swellings, and in all that chaos, it teaches you how to be calm. And that's one thing I did learn in MaxFax, is how to keep calm, resilience, and the importance of working in a wide team and building that communication, that network with them. Unfortunately, MaxFax wasn't the path for me. I don't think I was prepared to go back into university and do a second degree in medicine and work the long clinical hours and do the night shifts. So I decided to go back into practice. And currently I'm working in a mixed NHS and private practice. So being an NHS dentist, it enables me to provide care for those who really need it, those who need the accessible care and can't afford private work. And you're still doing so much. You're working over so many specialties. You're doing, one day it could be filling, one day it could be a root canal treatment, one day it could be taking teeth out, and you're covering all those bases still. And as a private dentist, I have the space and time to then do more advanced aesthetic work and help those who want to build upon their confidence by improving their smiles. And along the way, on that note, I have done courses in composite bonding and Invisalign. Some of you might have heard about these. But essentially, in this day and age where social media presence is growing and people care about how they look and cosmetic work is coming to the forefront, especially after COVID, actually. I've had a few patients come to me being like, oh, on a Zoom call, I've noticed that there's something not right about this tooth, or there's certain infections about my smile that I'm not happy with and I'm having to talk like this all the time. And when you're able to provide that cosmetic work for them, I've had patients cry in the chair when they've seen that finished result. And it really does, that's the kind of dentistry that does end up sticking with you. You really are making a difference in these people's lives. That being said, it's not all fun, it's not all positives. There are challenges to dentistry. And like I mentioned before, it's really important to protect your mental and physical health. It's so easy. I mean, I feel like a 40-year-old. I'm 31, by the way. I've got back pain, I've got neck pain, I've got wrist pain, I've got pain everywhere. And it's so important to be able to go to the gym, do things like yoga, meditate, protect your mental and physical health, strengthen your body, strengthen your mind, because it's so easy to have a bad day as a dentist. You're going to have one patient that comes through and gives you a pretty hard time, and you don't want to take that stress home with you. You have to be able to shut that out when you go home. The second thing, communication. Communication is so important in, I think, every field, but especially dentistry. You have to be able to empathize with your patients. Everyone coming through that door, most of them, they're really anxious. They've actually got a fear of dentists, some of them. And you have to be able to care for them and relate to what they want. They have to trust you, because you can be the most skilled dentist in the world, technically the best. But if you can't communicate with your patients and if you can't get them to trust you, you're not going to have a patient to treat. So that's really, really important. And that being said, you're going to have so many different personalities walking through your door. As a dentist, you have to be able to adapt to those personalities and treat them the way they want to be treated. And lastly, dentistry is about constant learning. 5 years of dental school? No, that's not it. You are going to be learning every day for the rest of your dental career, whether that be updating yourself on clinical guidelines or learning about new technology. as we've talked about AI, it's ever evolving technology in dentistry. You need to get on board. And also, be prepared to learn, because that's the way you're going to give the best back to your patients. To all of you guys out there who aren't sure what you want to do yet, one thing I'd say, do something that's meaningful to you. Make sure you're passionate about what you're doing. Dentistry, it's not an easy job. You have to be passionate about it, because otherwise you're not going to enjoy it. You are going to end up getting burnt out, and that's not great. And secondly, don't compare yourself. Don't get caught in that trap, especially as a dentist again. You see all these social media things, people posting about what they've done in their practice that day. Sorry, I am nearly done. And it's so easy to think, oh, should I be doing that? Should I be doing that course? Again, as you guys would be thinking, should I be taking that subject? Should I be doing that degree? Just do what feels right for you. You alone know what you excel at. You know what you're passionate about. Run your own race, guys. Don't fall into the trap of following someone else or listening to what your parents have to say. Sorry about that. And lastly, ask for help. Ask us, ask your teachers at school, ask older relatives. Everyone is there willing to help you. You are not alone, even though it might feel like that sometimes. Thank you. Thank you for listening.
I warn you that these 8 stellar personalities are going to come with lots of pearls of knowledge. In her case, I have no questions for her, simply because I hope somebody's taking notes. The decision of going back to her practice is a clear sign of clarity. The conviction of making sure she comes and states this defenselessly because she's absolutely confident and convinced that she's on the right path is the next decision. So what we started off today morning was about maintaining clarity, confidence, and conviction as the only holy grail to circumvent every other stone that's thrown on your path. Thanks for being a classic example.